The user logs in using a secure connection. The portal is configured by a hospital administrator. The tomograph performs the patient scans, while accelerators apply the radiation treatment. Treatments are created by radiophysicists. For this demonstration, we are going to perform a verification of a breast cancer treatment. The accelerator, tomograph, and dose algorithm are selected. The Monte Carlo algorithm calculates the radiation dose to be applied to the cancer and is highly computationally demanding. The treatment files are anonymized to guarantee patient privacy before uploading. A preview allows the information to be checked before committing to the verification process. The viewer displays the contours of the body tissue that is to be treated, in this case the breast. For demonstration purposes only, we check that no computational resources are being used at the moment. However, thanks to the SLA component, it is guaranteed that enough computing resources will be available. The verification process can take several hours. The progress can be checked on the web portal. When the process is finished, an email is sent to the user. A completed breast treatment verification is used to show the results of the verification. This screen allows the configuration of some visualization parameters. In the viewer, the contours of the tumour and body tissue can be shown. Here, the dose distribution, calculated by Monte Carlo, is shown, which allows verification of the planned treatment. This can be compared to the dose calculated by the standard hospital software by using the gamma map, which shows the difference between the two proposed treatments. Another way of comparison is the dose histograms. These show the dose level that is applied to each organ. Behind the scenes, two components used to ensure security are highlighted: PDP and PEP. Here the sequence of filters for requests is shown. When a request to e-Emirates service is made, a new message is created and a user role is associated. The component checks whether the request has expired or is permitted. Not all roles are allowed to access all services, hence a request has to be authorized. PDP also protects against so-called SQL injection attacks. Here such an attack is demonstrated and the false request is blocked. Now a correct request performed by the hospital administrator role is submitted. It asks for the list of users which are shown in the response. The PDP log shows that the request of a hospital admin role for a resource, list of usernames, is confirmed by returning permit. When we perform the same operation with a normal user role, the response will be message blocked. And in the log, we see that the user's request is denied. In the monitoring tool of the gateway, we can see permitted and blocked messages. Back in the portal, the SLA component is demonstrated. The verification started earlier is still running. Going behind the scenes, now 3 high-performance computers are used to perform the verification, where previously we didn't use any resources. The number of computer nodes in use can be seen. 15 nodes each on the first two computers and 60 on the third. In total, 90 nodes are used. Back in the portal, the system administrator can manage the SLA component. Here we can set the global conditions for the negotiation. Looking at an existing resource, we can see the individual conditions such as the number of cores, cost, and memory. Going back to the resources being used, these were negotiated by the SLA component based on the conditions we just saw.